So hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about Amsler grid test. Okay, so let's start. So before going to the discussion on Amsler grid test, first of all, let me know a brief idea about the tool that is used to perform this test. That is Amsler grid card. So this Amsler grid card is looks like a graph paper where there is a vertical and horizontal lines are there, and there is you can see a central dot is also there. So this is the Amsler grid card which is used to evaluate the macular pathology as well as any visual pathway disorders also. Okay, so this Amsler grid card is, you can see, this is covering this part of the retina. So it is this test was invented by Swiss ophthalmologist Mark Amsler in 1945. Okay, so these cards look like this, and you can see in this fundus that this card is covering this area of this is the macular area. Okay, so when the patient is holding this card at a specific distance that I will discuss with you all in the later slide, then it will cover the central 20 degree of the visual field. Okay, so this Amsler grid card is having 20 squares horizontal, also 20 squares vertical, and there is in total 400 squares are there. Okay, and this half is covering the central 10 degree, and this half is covering the central 10 degrees. So in total there is central 20 degree, and similar way there is also central 20 degree. Okay, and the size of each square is 1 centimeter, or you can say 10 millimeter. Okay, um, so that's all in the Amsler grid card. Now let's move to the procedure how it is performed. Okay, so I again say that Amsler grid card is not only used in detection purpose, but it is also used in screening also and monitoring about the fundus state. If the person is having any type of disorders or abnormality or pathology in his macular area, then to monitor the what is the progression or what is the gradual reduction of his disorder, Amsler grid card can be used, and it is very much inexpensive, so that it is very easy to use. Now in the procedure that you can see in this points, that patient will wear his corrective glasses. That means the best corrected visual acuity should be wear. Okay, after that each eye is tested separately. Okay, that means you will need to perform this test molecularly. After that, the distance from the chart is and the patient is 40 centimeters. Some examiner prefer 35 centimeters, some examiner prefer 30 centimeter. Okay, so it should be in the normal reading distance of the patient, and the patient is instructed to focus on the central dot. That means you will instruct the patient to focus on the central dot, and the patient is instructed to inform if there is any absence of square or distortion of the line. So after giving the patient the Amsler grid card and occluding his one eye, you will need to instruct the patient to see the central dot, that the central dot is here. So you need to instruct the patient to look at this central dot, and also instruct the patient to inform you that if there is any distortion of these lines are there, or any missing part is there, like from the corner or in the center, it is missing or not, or is there any inward or outward deviation of these lines, like these lines are not in straight, sometime it become this type of elevation is there. Okay, so is there any type of abnormality here, you will instruct the patient to inform you, and depending on the patient um, uh, what to say response, you will need to diagnose what can be the problem. Okay, now what are the following questions should be asked, that these are the questions that you need to ask, that can you see the central white dot in the central of the grid, that I already told you. And another is that while looking at the central dot, can you see all the four quadrant of the chart clear chart simultaneously. That means you are going to observe that the patient is able to see the four corners or quadrant of the chart while looking at the fixation point, that is the central black point. Okay, and thus the grid is having any missing or distorted area, that is you are going to assess any type of missing or distorted area is present or not, and any square is blurring or missing. So this blurring and missing, here blurring denotes a specific type of scotoma, and missing also denotes specific type of scotoma. So blurring denotes the relative scotoma, and missing denotes the absolute scotoma. Okay, now these are the different types of Amsler grid chart that are used in to detection or the screening purpose of the macular pathology to find out what can be the uh, possible pathology. Okay, now let's move to the discussion on each and every chart separately. Now this chart that I already showed you, that this chart is having 20 squares in the horizontal, 20 squares in the vertical, and in total there is 400 square, and each square is having any that measurement of 1 centimeter, that is 10 millimeter. Okay, and you will need to instruct the patient to see the central spot, and also instruct the patient to inform you if there is any absence or distorted line are also there, or absence of corner or quadrant or there. So this is the purpose of doing this test. Now let's move to another chart that is you can see here. So suppose your patient is unable to fix on the central spot. Okay, so what you need to do, so at that time this Amsler test or Amsler grid card is used, where there is two diagonal lines are written there. So these two lines will help the patient to fixate on the central spot. As if the patient inform you that he cannot see the central spot, then you need to give this Amsler grid card so that the patient will follow these lines to reach the central spot. Okay, so but the working is same as this one. Okay, now let's move to this red, where you can see the red lines over the black background. So as we all know that red is having a longer wavelength, so if there is any deficiency of colors is there, or any type of optic neuropathy is there, or optic neuritis, then you can give the patient this chart, as due to that longer wavelength the patient can perceive this lines clearly and can inform you whether there is any abnormality or distortion of the lines are there. The procedure is same, principle is same, just depending on the use, when it is necessary to use these charts, there is several types of chart are made. Okay, now you can see this picture here, only horizontal lines are there and there is no vertical lines. Okay, but the central spot is there. So actually this Amsler grid card is used to detect any type of reading disability. So if the person is having some reading disability, that he cannot read properly, any distortion of the lines are there, like inward or outward deviation of the line are there. So to detect these things, you need to give the patient this Amsler grid chart which are having only horizontal lines. Okay, so this will help you to detect whether the patient is having reading disability or not. As suppose the patient complaining you that when he reads the newspaper, then it seemed to be that the lines are rotated inward or lines are rotated outward. Okay, so at that time you need to give this Amsler grid card to detect this type of problems. Okay, now let's move to another. Here you can see there is no lines are there, no horizontal and vertical lines, only the different only many dots are there. So what is the purpose of this card? So here this card is used to detect only scotoma. Okay, no micropsia or macropsia of the lines. Okay, so this is only used to detect the missing of any area. Okay, so after giving this chart to the patient, you will instruct the patient that to inform you if there is any missing or absence of any part of the chart is there or not. Okay, and depending on the patient response, you need to understand that whether the patient is having scotoma or any field defect is there in the central 20-degree. And then if it is suspected, then you need to send the patient to HBF, where you need to perform the 10-2 examination to better evaluate these things properly. Okay, so let's move to another test. Here you can see that there is a dense squares are made. So as I already told you that this each square is having a measurement of 1 centimeter or 10 millimeter. Okay, but this dense area is made to increase the accuracy of the Amsler grid card test. Okay, so this squares is having measurement of 5 millimeter, so that you can detect any type of a macular abnormality with the help of this card easily. Okay, another oh sorry, so here I gave you some examples of any abnormalities that you can have and what can be the possible diagnosis. Here you can uh, see that this is the normal Amsler grade card, and here you can see this is the scotoma, that is absolute scotoma is present, is also metamorphosia. So metamorphosia or distortion, that means metamorphosia means the lines are not in the uniform manner or straight. There is any distortion or bending of the lines are there. Okay, so here two types of metamorphosia are there, micropsia and macropsia. In micropsia, the lines will seem to be rotated inward, and in micropsia the lines are seem to be rotated outward. Okay, so these are the two main types of metamorphosia. Okay, and here you can see this is the scotoma where there is absence of those lines are there, so the patient is unable to see this area. Now let's move to this area. Here you can see this is the normal Amsler grade reading, the patient, if the patient is having normal vision, but here you can see there is a AMD. So due to that AMD, you can see there is a distortion, is also a blackish appearance of this area. So as you all know that the main symptom of AMD is central vision defect, as it affects the macula mainly. Okay, so AMD is due to smoking or any alcohol consumption. These all lead to age related macular degeneration, and the most common is dry, and its severe form is wet ARMD. Okay, so this is the case of AMD. Now here you can see also, this also is the case of AMD, where you can see there is a distortion of the lines are there, there is metamorphosia, as well as there is any scotoma that can be seen, that is a relative scotoma. Okay, now here you can see this is the macular edema. Okay, now this is the macular tumor formation in the macular region leads to this type of appearing of the Amsler grid test. Okay, now this is the absolute central scotoma, where there is nothing can be seen here, this is the absolute. Okay, now central metamorphosia, so if there is any defect in the central part of the macula, then it leads to central metamorphosia, as well as if it is due to ARMD, then it leads to absolute scotoma in that area also. So this is the central metamorphosia. Now here you can see the this corner or quadrant is missing, so it can be due to glaucoma of the quadrant can be missing. Okay, so here also you can see there is a distortion of the line. So another thing I need to clarify to you, all of you, that when you are performing this Amsler grid test with the help of Amsler grid card, you need to instruct the patient to see the central spot, and the patient will inform you whether there is any distortion. So you give a pen to the patient and instruct the patient to draw. If there is any black area is there, then where is the black area, you need to instruct the patient to draw it. Okay, and if there is any distortion of the lines, then also you will instruct the patient to draw that distorted line, so that you can understand that whether it is micropsia or macropsia, or whether it is absolute or relative scotoma, or ARMD or macular edema tumor formation. These are the things that you will get to know when the patient will draw those appearance of the Amsler grid card to that patient, how he sees. Okay, so always instruct the patient to draw those lines. And suppose the patient is under medication or under treatment of ARMD, so you need to check what is the progression of progression of that ARMD. Okay, so that you need to give the patient the ARMD card to the patient. You need to give several cards, and always instruct the patient to note the Amsler grid card every day, that how he sees. So it can be continued to 1 month or 2 month. Okay, that so that you need to see what is the progression of his ARMD, what is the current situation, how he feels, how he see. That you will see by performing this thing, that give this Amsler grid card to the patient and instruct him to draw every day. And when he will come to you review to clinic, when it can be 2 month or 1 month depending on the consultant, then you need to see that how that progression was. It is like a screening or checking. Okay, his progression of his pathology. So at that time you will need to check. Okay, so that's all, friends. Thanks for watching, and please don't forget to like my video, subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Okay, thank you so much.